So, as Simon said, yeah, I'm Richard Kemp, and I was pleased to be able to do this presentation for Farming Connect, because it's an interesting topic, and it is an unpredictable problem. And when it comes, well, as we'll see, it can be a minor problem sometimes, especially if you get on top of it quickly, but it can be a very severe one. So let's get into the talk. So, okay, this is what we're going to talk about, and those are obviously, this is the this is the lung of an animal, and these are the terminal bronchi, the very last end, the sort of tubes right into the lung, and here are the adult worms sitting there, and you can see how they would cause a lot of problem. So during the talk, we're going to look at the importance of this parasite, look at the parasite itself, and look at its life cycle, which is crucial to understanding how we can control it. Look at immunity, and again, the immunity of the cow, how and over what time scale that develops is critical to understanding and controlling this disease. So from this, we'll get an idea of what cattle, where and when we might see this disease in. So then we're going to go and talk about the actual disease and the different manifestations of it. And that is quite varied. And then, importantly, how are we going to diagnose this disease? How are we going to treat it? And maybe, critically, how are we going to prevent it? So, importance. I think a lot of people understand how important it is, but in a severe outbreak, obviously there will be deaths. There's treatment costs of any outbreak of disease, and those can be severe. Ill thrift following recovery is never trivial in any form of pneumonia, including lungworm, which is a verminous pneumonia, and hence lost growth. And in adult dairy cattle, potentially without any of these, we get lost production. I think it's half a kilo a head a day is a standard figure. So that's a lot to lose when you factor it up to the herd level. So growing cattle losses of 50 to 100 pounds per head. So adult cattle outbreaks, if you have a fairly small herd of 100 milking cows, or a normal, well, I won't say small, but a 100 cow milking herd, it's 17,000 pounds we're talking about potentially. So it is an important disease. Okay, so the parasite itself, these here, this is where it really starts, and this is obviously a blade of grass, and these are the infective, these are the L1 larvae. So this is what the cow produces. So the L1 larvae go in at this end. They go in and basically these then shed, they go through a few molts, and they go then, you get L1, L2, and then L3 find their way into the lungs, and then turn into adult worms, which produce eggs. These eggs hatch, they're coughed up. So you have live L1 larvae coughed up from the lungs, and then swallowed in sputum and passed out the other end. Hence, and then we've got pasture contamination. You can actually, if you have a patent infection that's coughing up eggs and larvae, you can get a quick sample. You can sample sputum, and you will find that these L1 larvae, the infective larvae, in the sputum, I should say. The other thing that's interesting about lungworm, which is quite unusual, is that the larvae are actually drawn to this fungus, which is called a pilobilus fungus, and these little black dots are the spore boxes. Now the larvae are drawn to these by sort of a chemical attractant, and when they get on there and these boxes explode, they will spread the larvae over quite a wide area, so they can spread from pats to wider, cleaner pasture, which does help with their spreading around. So this is the life cycle. So the immune response is, we can break it down to a response to the infective larvae. So how well does a cow fight off becoming infected and taking on? How well do these larvae survive? And then how well does it kill adult worms? And it's important in the epidemiology of this disease that these are different. They both need exposure to develop, and again we'll see why that's important later on in the talk. And also, interestingly, there's quite a difference in the length of immunity after exposure to the larvae, so to what they're ingesting, the first stage of this, and to the adults that are in the lungs. It's only 4 months for larvae, whereas it's 2 years for adults. And this does have important sequelae, important implications for the disease. And we'll talk about reinfection syndrome later on. So, who, where, and when? The classic picture for lungworm is that it's dairy cattle in their first grazing season, and that's probably a very significant element to the disease, and when it does occur there a lot. But we have seen changes in this, which we'll go on to discuss. It has changed in how it presents a little bit. It's important to realise that autumn-born, a suckler that's on the mother, which when they go out in the spring, aren't going to be susceptible. But autumn-born single suckle beef calves are just as susceptible when they're turned out into grass next year, just like dairy calves. And weaned beef calves, if they're grazed for a very long grazing period into the late autumn, can become vulnerable. And also importantly, again, maybe not what we always think of as lungworm, because we always think young stock, but in various situations, we find it can cause significant problems in adult dairy cattle. So where? Well, I mean, the great thing about lungworm is that we know it comes from grass. So if we get a problem, they've had to have been on grass within a week or two. We won't get problems otherwise. And it's a good indicator that other diseases, other viral diseases, we don't really expect in that situation. So it can be an indicator in that direction. Is it a problem in Wales? Well, it likes wet conditions. So that's a clue that yes, it's an issue in Wales. In the rest of the UK, there's been changes in its distribution, and this is so it is what's the expression? A developing, well, an active current sort of disease that there is changes happening in it, whether that's due to climate change, whether that's related to a decreased use of vaccine or more use of long-acting wormers. And it's changed so that Southwest England was a very big problem area, now very much more North England and Scotland. Wales maybe has seen a small increase as well. So when, well, we always think, as Simon said, this is the time of year when we have, lungworm should be in our minds, and that remains true. But on the other hand, it can occur almost any time of year, really, over a wide spread of seasonality. It is unpredictable, and that has become more of a feature in recent years, really, certainly in recent decade or so. So this is a little bit undecipherable, I see now. Hopefully, or maybe not, but you can get a feel that this is cases as diagnosed by well, was it the VLA then or the APHA? It was VLA then, diagnosing lungworm, and they've looked at the seasonality of this and when they found cases. So this is early on back in the 70s, and this is much more recently up here. And you can pretty much see a widening of this spread. Now, obviously, there's factors to do with who's looking for lungworm when may have some impact, but the general view is that there has been a widening of the seasonal element, so it's occurring earlier and later than we previously have thought. And it can occur even very soon after turnout sometimes. So the disease, well, there are different names. Classically, it's parasitic or verminous bronchitis. Husk or hoos are often used. Lungworm commonly. And the presenting feature is a cough. Now that cough can start off in just the odd animal. Often we're looking at a group as a rule. We're pretty much always looking at the group, but some are going to start sooner than others. And the cough may only be apparent if you move them. You know, when you move from field to field, or you just stir them up, they come running for some cake, you'll start to hear a bit of a cough. If you examine these animals, you'll start to see an increased respiratory rate. There'll be maybe a bit of a snotty discharge, and often initially without fever. So the worms in the lungs don't evoke a fever like a viral organism might do. You'll see difficulty breathing. So not only are they breathing fast and they're coughing, but they're heaving, they're pulling hard. When they start to stick their tongue out, you know, they're mouth breathing, they're really struggling. That's obviously a poor sign. But on the other hand, this is sort of building up in the severity we're seeing, but you may see very little of this, but see milk drop in adult dairy cattle. Half a kilo cow a day is one estimate in a sort of mild subclinical case. But, you know, when you multiply that up over days and cows, it becomes very significant. So, that's me about there. Right, well, what else, if we see this kind of pattern, what else might it be? You know, what could we confuse it with? Well, there are a host of things. Viral diseases, IBR, RSV, and PI3 are key ones. Bacteria like Mannheimia or Histophilus. Mannheimia used to be called Pasteurella, so they keep changing names. Bacteriologists like nothing better than changing the names of things, but Pasteurella, as you would have called it. And also some other things like mycoplasma pneumonias. Also, farmers' lung sensitivity to, say, if they're getting very dusty feed, they'll cough, they'll have increased respiratory rate. I think the key thing that we can use is these can occur at pasture, but when we're out in the grass, and if you have the timings roughly right, bearing in mind the timings aren't always very tight, it's not always exactly this time of year, it's widespread, then at grass we start to think much more about lungworm. It's important to remember also that it might be more than just lungworm. I've put here, it's quite common to get co-infection with IBR. So IBR is a virus that is often around. It's around on a lot of farms, and it doesn't always cause any particular problem. But if lungworm acts as a stressor on an animal and lowers its immune system through stress, well, IBR is willing to come on in and potentially change the nature of that outbreak, make it much more severe, or certainly add to it. And also, if animals are coughing, IBR is going to spread around a lot better. So that may well come into it. Also, things like BVD. If animals are infected by BVD, their immune system will be lowered, and they may not fight lungworm as well, and vice versa. Excuse me. So, there's the differentials that we could get mixed up with. So, okay, getting a diagnosis. Well, sometimes we can go on clinical signs and history. So the time of year, the kind of pasture they've been grazing for how long, and the clinical signs give us a very strong idea quite often. If we're unlucky enough to have had animals die, then that's the plus side of that is we can do a post-mortem, and we go back to seeing the larvae, seeing the adults in the bronchi, and we know just what we're dealing with when we get that. So that's a very useful tool. It gives us a quick answer if we have a dead animal. But we'd rather not get to that point. So we want to do some testing. So lab testing, we can look at sputum directly, but often we it's easier and simple to get feces. And what we want really is we need live larvae. And what happens is, I can't see my picture of the Bayerman apparatus, but maybe you can. Can you give me a thumbs up if you can see the Bayerman apparatus in its entirety, Simon? It's hidden behind that on my screen, but either way, what we do is, in this funnel, we place the fecal sample, and we leave it for 24 hours. And what happens is the live larvae swim out of that fecal sample, and then they sink down. And then we take a sample from the bottom of this apparatus, and then we've got the larvae. And it's as simple as just looking and seeing that the larvae are there. And that's very good. There are issues with this. One is we've got to be a bit careful about the sample. It's got to be nice and fresh. The 20 in a fridge, 20% die in 24 hours, so there's some die off. But in at room temperature, let me think, it's between 24 and 48 hours, 60 to 80% die. And if they die, they'll just sit in that feces in the middle of that apparatus. They won't swim out. We won't find them. So it's got to be a fresh sample that's not sat in a Land Rover or God forbid, a vet's boot for any length of time, or we won't get a good result. And also, apart from looking for the larvae, we can also do serology and look at for the immune response. Obviously, there again, there's issues with that. And hematology, we can look to see if there's a white cell called an eosinophil. If they're elevated, that can be an indicator of a parasitic infection, and that can be again a quick look-see if you want to get rapid results. Whereas other things may take longer, and I think it's a disease that you need to get in and treat quickly. If it goes too long, they're much harder to treat. So the sooner you get in with the treatment, the better. So it may be we don't wait for diagnosis, but we do want diagnosis ultimately at the farm level, really, to know that this is what we were dealing. That was what we were dealing with, and that we know we can plan then for future years. So the other big problem with diagnosis, apart from the sensitivity of tests, is that when animals first develop infection, there's a time between the larvae getting to the lungs and adult lungs, but it should be adult worms producing eggs. So that's quite drawn out. From ingestion, it takes 1 to 7 days for larvae, L3 larvae, to make their way into the lungs. But then from the next 8 to 25 days, you've got adult worms there, but they're not yet capable of producing eggs. So if you take samples and look with the Bayerman apparatus, you won't see eggs. Sorry, you won't see larvae. They don't produce eggs, which then hatch into larvae. So during that first 8 to 25 days, depending on the nature of the infection, we'll see nothing. So that makes it difficult to get a timely diagnosis sometimes. Coughing can be heard after the first week when these larvae, the L3 larvae, are working their way into the lungs. And then that generally builds up to more widespread and more severe issues over 2 or 3 weeks. So by the time we've got more severe disease, we may well be getting a patent infection, which we can detect in the feces. But we might not, and we can't rely on that. Also, if we've had coughing in week 1, we really want to have treated by then, don't we? I would have said. So, herd level testing, yeah, that can be very useful, but we do need to sample several animals. If we just sample one animal, there's a good chance of missing the disease. So either by the Bayerman test, which is a sort of fecal sampling, or by serum ELISA, so serology, a blood test, we need to sample more than just a couple of animals. This is based from work that was done in 2012, and it was on I think quite a small herds. They looked at average size of 73. We can extrapolate up and get a rough idea how many, in a larger herd we should do from this. And it's interesting that because heifers have a weaker immunity, they're more likely to get a positive test. So we don't need as many to sample in those. And it looks like the serology is the better test, in that we can get better confidence of finding the disease with fewer samples using serology. And I think cost-wise, it's probably works out similar. Probably cheaper because we need fewer samples. Serology, though, does need time to. The immune response won't necessarily show strongly straight away. So again, it can be a little bit down the road. Maybe we want to treat before we get to this point in a disease outbreak. So treatment, in a way, treatment isn't complicated. We need to worm them. And as I say, I believe in that. I personally believe strongly in getting that done rapidly and asking questions later, really. There's no resistance reported in lungworms, so we shouldn't have any issues with which worm we use. It's important to move them off the affected pasture so they don't keep ingesting more infectious agent. Often they will, in very mild cases of a cough, you worm them. If they're not really ill, they're not really breathing badly, that worming them is enough, but they may well require antibiotics, and maybe more critically even, anti-inflammatory non-steroidals or metacam and flunixin and ketofen, those kind of drugs that are protective of the lungs. And when we know with all pneumonias how important the long-term effects of pneumonia can be, the non-steroidals, these drugs, these anti-inflammatories really help, they're worth the money to help stop further losses down the line from ill-thriven and poor animals. Even with the best treatment possible, even in a timely fashion, if it's quite an acute flare-up, in some disease with more acute disease, up to a quarter or around a quarter of calves that are recovering can have an acute flare of disease and can really even die. I don't think that's fully understood why that happens. It's perhaps likely because we get worms, dead worms dropping after treatment into the alveoli and getting secondary infections and things. Reinfection syndrome is a slightly different thing, and this occurs when you have an immune animal that has, well, I say an immune animal. We discussed before the idea that there are two forms of immunity, to the infective larvae and to the adults. And the infective larvae, if an animal's exposed at one stage in its life or one stage in the season, often perhaps in its life, if it's had a big exposure, it develops good immunity both to the larvae and to the adults. But a year later, the immunity to the adults is strong and there'll be a strong reaction against them, but there isn't a strong immunity to the larvae. So the larvae will come into the system, they will work their way to an adult. At that point, there's a very strong reaction from the immune system, which is really a hypersensitivity reaction, which causes very severe changes in the lungs and then quite often sudden death. So this would be individual, either groups or animals that have had this quite a high exposure and then are re-exposed at a later interval. And I say that can be sudden death or severe disease. So prevention, this is really obviously crucial. I think I should say at some point that, well, it's difficult to predict. What we do know, some farms know they've got an issue and they know it's around. Other farms maybe have it and don't know, and somehow don't have that big an issue. We know from work in Ireland, obviously this is Ireland, not Wales, but there are some, we can think maybe there may be some similarities. It's worryingly common. Tests using the Behrman apparatus done in Ireland on cull cows showed, 14% of cows, cull cows in Ireland, tested positive for lungworm. And when they've done bulk milk sampling, they found 62% of bulk milk tanks have shown a serological response to lungworm. So it's quite a high percentage. Now, there are issues with bulk milk testing. They've used it there for research purposes. At a herd farm level, it's not a useful test. It's not it's not sensitive enough to meaningfully pick up disease. So it was not something we routinely use. So yeah, it's difficult to predict. That's the real thing with lungworm. It's quite short-lived on pasture, and it relies on cycling through cattle, and we saw a sort of circular thing with the cow ingesting, pooping out, ingesting, and it builds up on pasture over the summer. Sunlight will kill it, bright sunlight, but dry weather will kill it. It likes rainy, wet weather. So for some worms, we know there are, you've probably seen the NADIS forecast, which can be very useful. You can find those online there. There isn't a particular forecast. The lungworm is a bit too irregular and random to nicely predict, but we can look back on NADIS and see when there's been wet weather. And if you have a lungworm problem, it might be, we all know there's been wet weather, but it's hard to remember back to just how has it been. You can see weather forecast, where the summer is on that NADIS site. And then so the weather, if we get the weather that's conducive and the stocking densities are high, we've got to look out for disease. The grazing history. So lungworm is spread really or persists through carrier animals mainly. It's surprisingly large number of animals that are infected. 10 to 20% become, say if heifers become carriers. So next year when they go out again, they'll produce initially a low number of infected larvae, but then these numbers will increase as they cycle through the pasture. So worming history obviously is important, and we come back to this idea that with the lungworm, it's very much exposure to the exposure leads to increased immunity, and as long as increased immunity keeps up with the exposure, we may not get too bad a disease. But if numbers on the pasture beat immunity, or we get animals that are not immune exposed to high levels, we're going to get disease. And because of all these different factors, we find this is it's unpredictable, as hence the title of the talk. And also, another thing is that in terms of prevention, although we do is, grazing management is part of it, because obviously you don't want to put, for the reason we discussed, that we want to match the exposure of animals to their immunity. So immune animals can go okay on dirty pasture, but if at the end of the summer you put animals onto that area that are naive because they've been in the shed for until recently, they are very vulnerable to disease, and their immunity that in the other animals has built up over time, it doesn't match the exposure. So low risk grazing management is part of it, but if there's a lungworm on the farm, just manage it through grazing isn't possible. Partly because you'd have to move them. The life cycle of the lungworm means that you'd have to move them every couple of weeks, and that wouldn't really fit with your gastrointestinal worm management. So that's not going to fly. So worming, a lot of people do use worming for lungworm control at some level. Wants to be timely, but if we worm and worm and worm, then all we'll do is delay the issue. If we worm them so hard they don't get exposed at any point in the year, then next year they're going to be extra vulnerable because we've stopped them developing their own immunity. So it's a balance. If we're not careful, we'll delay the problem to the second grazing season or to adult cattle. So vaccination is the best way really to be confident of controlling lungworm if we've had problems on the farm. So, sorry, oops, that's my notes. So there's a vaccine we all know. I'm sure we probably all know about the vaccine Husvac. This works on using live L3 larvae, that's just before adult larvae, and they're irradiated to stop them being as vigorous and hopefully to produce any real strong infection, but they will stimulate the immune system. This will reduce the clinical signs of disease in exposed animals, but it won't stop infection. It's always a numbers game with a disease like this, like with a lot of worms, and it's numbers in immunity and then the numbers that we then get in the animal and causing disease. So it knocks the numbers down. It prevents against real major disease, but these animals aren't clean. They aren't clear of disease. And critically, we need, just doing this vaccination will not lead to solid immunity for the rest of the season. They need to be exposed to lungworm ongoing. So we want to turn them onto dirty pasture, and really critically, the number one no would be is that we mustn't worm just before or at the same time as vaccinating, because then these animals will go onto pasture. If you go onto clean pasture and the worms are cleared out, they'll get no top-up immunity really, and that's going to be a waste of our money then, because by the end of the season they're going to be very vulnerable. Another thing is, because the larvae are irradiated, yes, they're taken down a peg. They're not going to cause major disease. They're just going to act to stimulate the immune system, but they can go through all the way to producing eggs and kicking off a cycling infection. So we must always treat everything in the group, otherwise some will be left without protection, whilst the others will be producing eggs from this vaccination. So can't remember my next slide. Here we go. So the other thing about the vaccine use is that's not problematical but needs to be taken into account is that it can't be used until 8 weeks of age. The 2 doses 4 weeks apart, and immunity doesn't start or isn't solid enough for 2 weeks after that. So 8 and 4 and 2 is 4 is 12. It's 14 weeks. So nothing can be turned out until it's 14 weeks old at the youngest, and this is obviously for certain systems an issue. So On this case, we may have to use long-acting wormers for animals that can't be vaccinated in time. But what we've got to realize is that next year they won't have developed an immunity, and we can vaccinate them then. And we must remember to do that. Some people might also use long-acting wormers in the second season of grazing. If so, if you've got strong reasons to do that, okay. But if you then put animals into the adult herd, heifers may well not, well, are quite likely not to have immunity then, or not a good enough immunity, and we're very vulnerable to outbreaks then occurring in heifers that join the adult herd, because the adult herd will be grumbling along quite happily with worms in the system, but they're immune. These heifers are going to be naive and have problems. So, biosecurity, I guess for some people, I mean, a lot of people listening may well have had lungworm issues, but if you don't, the best thing is to not bring it in. Obviously, maintain a closed herd if possible. Now, again, people can't always do that. It doesn't suit their system. But you must realise that carrier status is very common in lungworm. We discussed before with the cull cows in Ireland. And when you're buying animals in, there's more a good chance. It's a real risk that you will buy in lungworm. So we need to quarantine those animals and get them wormed before we allow them, even for a few days, before we allow them onto any pasture. And ideally, maybe even at that point, keep them away from other stock for as long as possible, really. But certainly we need to quarantine them when they arrive. We need to get them wormed and allow them to work before they go out onto pasture. So trying to put that all together a little bit, types of outbreak we can see with lungworm. The classic one, well, young stock, that's dairy young stock, that's where we tend to think of it, but it can even occur as soon as a month after turnout, so it can be quite early in the year. If the weather's been right, or maybe more importantly, if last year's heifers or whatever have been on the stock before these animals get turned out, they can be affected within a month of turnout, and potentially very seriously if there's a heavy contamination. Assuming we put the heifers onto, your calves onto clean or cleanish pasture, then often it's a build-up. So rather than a sudden shock to the system and within a month we've got disease, it cycles through these heifers, these calves, and it builds up, so that by the more typical time then of into July and September, we'd get disease because it's the amounts of build-up and overwhelm the immunity. Later on in the grazing season is when we can find it, and in autumn-born sucklers, they're going to be vulnerable then. Late in the grazing season, because we find our long-acting wormers are wearing out, running out. They've come, they've done their job, but we do have often quite long grazing seasons now, and that wears off. The animals haven't got immunity. Now, if they remain where they are, they're okay, because they've been wormed heavily. There shouldn't be too much lungworm on that pasture where they are. But if we regroup or we move them to contaminated pasture, or group them with animals that are carriers, they're very vulnerable. So late in the grazing season. Heifers joining the milking herd. If we've overwhelmed our heifers and they join the milking herd, they can be vulnerable, and that can be a presentation that we'll see. So we're not matching the immunity with the exposure. Adult cows can, again, this is a presentation that has been seen more in adult milking cows and causing a meaningful milk drop and disease, respiratory disease. That's really important, and it isn't always the heifers. If the worming has been excessive in the adults, for example, or if it's a herd where the disease has come in more recently. On open farms where we are buying in cattle fairly often, we can get disease in all animals, but including particularly adult animals. If your herd is clean but you're buying disease, then you've got no immunity, and it can get into the adults and it will cause meaningful disease. The other side of the coin is that infected herd that's got a lungworm problem ongoing, but so maybe it's not causing huge problems. But if you buy in naive animals, animals that where they're from, they haven't been exposed, then they're very vulnerable, and you could get a big outbreak in disease in those when they join your herd. So this is possibly, I don't know if it's underused really, but to vaccinate those animals, because it's fine to use in adult, including pregnant animals, to vaccinate those animals would be a very worthwhile investment to save you from potential huge losses there. So the vaccine, I think, isn't not just for the first grazing season heifers, calves. It can be used for in the second grazing season. It can be used in heifers joining the herd, even depending on the worming scenario. But also these naive animals that are coming in, they're so vulnerable. It's true of a lot of diseases that if you have disease circulating your animals, are often dealing with it fine. Animals that come in haven't got the immunity and they're very vulnerable, so it's a good chance to use that. And I think that's been quite long enough. I think I'm near the end. Yeah. So diolch am eich sylw. Thanks for your attention. And I think those are just some references for some of the talk. I think we'll go to questions, will we, Simon?
We will. Thank you, Richard. Interesting, informing presentation there. Thank you very much. And we'll now hand over to my colleague Rhys, who has taken or will be taking questions and direct them directly to Richard. So Rhys, if you can come in, please, I'd be grateful.
Yes, there's a few questions have come through here. Any difference, Richard, in the effectiveness of wormers if they're injectable or pour on against lungworm?
No, I don't. I mean, I don't have any specific data on that, but I have no reason to think there would be. No, I think either would be fine. I suppose you want rapid action, but they're both pretty quick. So no, not in my experience. No, either's fine, and it's important. The handier system might mean that you get a more timely treatment. So
okay, thank you. And then for a herd of spring-born calves, what is the best protocol for a Husqvarna vaccination program?
So for spring calvers, I think they're wanting to put their animals out, those calves out pretty soon, and they're going to be quite an age by the time they get to that point. By the time we get to the point of having vaccinated them in the first season. So I think in most cases, then probably the best option is that in that first grazing season, long-acting wormers are used. Now, there are alternatives to that as well, where it's just worming at regular intervals. But I think for most people, it's the long-acting wormers that are used. Either way, so worming anthelmintics that season, because you can do that often enough and in a timely fashion to keep that under control for that year. But all you're doing then is moving things over to the next year. So the second grazing season of these animals, they should be vaccinated. And then that's going to allow them to, without being heavily wormed, develop immunity. So after that, when they're heifers, and after that, when they go into the adult herd, they've got immunity that just keeps topping itself up, and they're set for life then. If we just defer it by worming, and in that first year, we're delaying the problem. But obviously, as you say, for those people, it's not really practical with Husqvarna, but you just move it on to the next grazing season would be my advice.
Okay, thank you. And is it a huge problem if I have lungworm in my cow's feces? Does it mean they are suffering, and is it a problem?
Well, I think basically the short answer is no, really. It's very common. We found, cull cows in Ireland, 14% had actual larvae in the feces. So we've got to assume there's quite a reasonably high level in this country in cows. It's not a disease where it's present or absent. It's very much a numbers game versus immunity. So it's going to be common to find that as a secondary finding if what we're looking at is, it doesn't look like lungworm. Obviously, if we have something that looks in any way like lungworm and we find larvae in the feces, I think we're going to take that as a good confirmation. But in an animal that doesn't show respiratory disease, then it's an incidental finding then, and not anything to worry about at all, except to bear in mind that it tells you that there is lungworm present. So if you didn't know that, for that individual animal, it's not significant, but at the farm level, if you didn't already know there was lungworm in your farm, you do now, and you need to be cautious and think about all the factors that we've discussed today.
Okay, thank you. And then one final question here. Is it likely that they will have an intestinal worms at the same time?
Okay, that's a good question. It's quite interesting. I think they are different, but they are both worms. They're both nematode worms. So, and they're both at some level increased by similar things. So a wet year, heavy stocking densities. So the life cycle is different. They pick it up perhaps more quickly. So they don't, it's likely, I think. I would say it's likely. So when you're going to be treating with something, hopefully that, I suppose, your choice of worm, for lungworm, it's not very important what worm you use. Perhaps for your gastrointestinal worms, it is more important because you've got a rotation program going, or you may know that you've got resistance to, well, to white drench particularly, but to some other drench. So it's worth choosing one that's going to get both, because yes, I think they don't go hand in hand, but the conditions that make one be a high, can make the others be high. If in doubt, worm egg counts are a good way of just checking that quickly and cheaply and easily. But there's always quite a chance of that.
Okay. Thanks very much, Richard. Yeah, that's the end of the questions I've had so far. Thank you.
Okay, Dale.